Good evening, everyone. On behalf of the Kamat sisters and their families, the Kangra Saraswat Association and the Saraswat Mahila Samaj Gamdevi, a special welcome to our esteemed speaker for this evening, Dr. Ravi D'Souza. Sadhana Kamat, Sadhan Pachi, as I've always called her, had held the post of President of the Saraswat Mahila Samaj Gamdevi and was closely associated with all its activities, especially during its Platinum Jubilee and Centenary years. She started the Advocate Narendra Kamat Memorial Lecture Series in the Samaj Hall in 2009 after he passed away. After Sadhan Pachi's demise, Shubha, Deepa and Anuja expressed their wish to continue these in memory of both their parents. The KSA then joined the Samaj and Kamat sisters to continue this yearly tradition. Being closely associated with many people from both the cultural and literary field, Sadhan Pachi would arrange to get eminent speakers from various fields. My mother, Shaila Hemadi, and Sadhan Pachi were childhood friends. Luckily, both their husbands too got along equally well. The Kamats have hence been more family than just friends to us, and so it's an honor to stand here to welcome you this evening for this evening's program. I would like to thank our speaker, Dr. Ravi D'Souza, for sparing his valuable time and come here to enlighten us on the topic Coping with Age. I now request Hemant Komrabai to speak a few words on behalf of KSA.
ओम श्री गुरुभ्यो नमः, श्री भवानी शंकराय नमः, श्री मात्रे नमः. आयच्या ह्या प्राध्यापिका साधना आणि ॲडव्होकेट नरेंद्र कामत हांगेल स्मृतींतू जावचे ह्या व्याख्यानमाळेंतू आयचे वक्ते डॉक्टर रवी डिसूजा, उपस्थित मान्यवर, सारस्वत महिला समाज आणि कॅनडा सारस्वत असोसिएशनाचे पदाधिकारी, कार्यकारिणी समितीचे सभासद आणि समस्त दर्शकांगले कॅनडा सारस्वत असोसिएशना वतीने हांव हेमंत कोमरबाई मनपूर्वक सहर्ष स्वागत करता. ही व्याख्यानमाळा साधना पाचीने नरेंद्र मामागल स्मरणांतू सुरू केलेली. साधन पाचेगल नंतर शुभा, विभा आणि अनुजाने ही व्याख्यानमाळा नरेंद्र मामागल्या आणि साधन पाचेगल्या स्मरणांतू जीवित दवरली. आज आम्ही डॉक्टर रवी डिसूजा गल्या म्हानतारपणा वटू जुळोवन कशी घेवचें म्हळ्यार कोपिंग विथ एज ह्या व्याख्यानाचो लाभ घेऊया. आता शुभा आयच्या व्यक्तागला परिचय करून दितली.
Good evening. I've been assigned the pleasant task of introducing our distinguished speaker today. Dr. Ravi D'Souza completed his undergraduate education from TN Medical College and Nair Hospital, Bombay. After this, he worked for 5 years in rural India. He then did his postgraduate training in community health from Christian Medical College, Vellore. He has worked in Maharashtra, Tamil Nadu, Orissa, Uttar Pradesh, Madhya Pradesh and Chhattisgarh in different capacities with grassroots level NGOs, mission hospitals, networks, and in an advisory role with the government. He has also been a faculty member in a rural management postgraduate program. His main areas of interest in public health are primary health care, essential drugs and rational drug therapy, malaria, TB, and nutrition. He recently completed a diploma course in geriatric care and was awarded a certificate of excellence for it. He hopes to work in the area of community and preventive geriatrics. He and his wife Ramani got the Paul Harrison Award from CMC Vellore in 2025. This is the highest award given by the college to its alumni for distinguished service in rural areas. Ravi is a very approachable doctor. I've known him for 30 years and I often call him and his wife for medical advice. He's always prompt in answering my questions about a particular line of treatment or clearing my doubts about a particular ailment. I'm so glad he agreed to speak here today. I'm sure you'll find his talk useful and he'll readily answer your questions afterwards. Before that, I call upon my sisters to welcome him with flowers and a token of our appreciation.
Thank you, Shubha, for the introduction. It is a privilege for me to speak at this occasion. Mr. Sadhana and Mrs. Sadhana and Mr. Narendra were the in-laws of my brother Dilip, and as such, and since I was not in Bombay for many years, so I didn't know them as well as perhaps I should have. But they were always very warm and accepting and always interested in knowing what we were doing. That is my wife, Ramani, and myself. And Mrs. Sadhana Kamat especially was always very affectionate and loving, and it was a shock to me also to hear that she had a heart attack, and then when she passed away, I thought she had many more years to live than the age at which she passed away, which was quite unfortunate. I was looking forward to meeting her and interacting with her many more times, but unfortunately she passed away, and it was extremely sad for me. So today's topic is something that I have been concerned with ever since. Quite a few older people, especially my father. I mean, I haven't said this before. He once said, "Old age is so painful," and that's got me thinking. Why is it painful, and why should it be painful? And I have interacted with a lot of older people and try to help them with their health problems and try to offer some advice or sometimes some treatment as a doctor. And this prompted me to do a course in geriatrics, which I completed last year. And I was the oldest person in this batch of students. I was in the geriatric age group myself, and all the other people were in their 30s, 40s, and 50s, and I was the oldest. And this course was quite rigorous with a proper exam and all at the end. So I managed to finish this course, and I did it because I was interested in it, not because it was going to help me get a job or I was going to get a higher salary or anything like that. And I did it out of interest and with the constant encouragement and sometimes a little bit of nagging also from the part of my wife. I'm glad she's not here today. But yeah, so I managed to finish it, and now I'm trying to use that knowledge, but not by sitting in a hospital and seeing patients. It's by working in the community as I've been doing all my life, trying to help people in their homes, in the community, and especially trying to help poorer people. Now, this is a big problem. This is a problem that's going to be increasing. The diseases or the problems of old age, because our population is aging. People are living longer and than they used to, and there is going in the years to come, the proportion of people who are older. The geriatric age group in our country is above 60 years, but in the Western developing countries, it's above 65 years, because their people live longer, they have a longer lifespan. But in our country, it's officially defined, the geriatric age group is people above the age of 60. So this is my interest in geriatric care. I hope I'm able to do something about it, because the need is huge. Wherever I go, I see people who are in need for geriatric care. Old age is a stage of one's life, yes, which comes for all of us at some point of the other. But it's not to be feared or dreaded, or, as my father said, it's not something painful. No, it needn't be these things at all. It's something that, yes, we have to go through. There are problems, there are difficulties, but most of them can be overcome. And this is the purpose of my talk today. I want to explain in non-medical language as far as possible some of the problems of old age and how one can cope or how one can overcome them. And I have kept it very simple because you are all non-medical people, and I've tried to avoid any I've tried to avoid technical terms as far as possible. So I will be speaking about some of the important problems or important conditions of old age and how one can prevent them. So I'll be touching upon a whole range of aspects of old age, including nutrition and what one can do to avoid problems or to manage problems if they occur. So as I said, it's growing old is a natural process and it's a part of life. And all of us have to face it at one point of time. And the physical effects of aging are on different parts of our body. The brain, the heart, the lungs, kidneys, liver, bones, muscles, joints, and so on. And some of the changes are inevitable and sometimes permanent. There's nothing that you can do about it. But many of the changes that one sees can be prevented or lessened, or managed, or in some cases even reversed by simple measures. And these measures or these changes are changes in the way we live, and you must have heard of this term, lifestyle changes or lifestyle. There are certain diseases which are also called lifestyle diseases. In medical language, they are called non-communicable diseases. But can all be managed or even prevented by certain changes in your lifestyle, and those are called lifestyle changes. The lifestyle diseases that we see, I'm sure many of you are familiar with these conditions: obesity, diabetes, hypertension, heart disease, and cancer. And if these diseases are managed properly, many complications are prevented. See, all these diseases have complications. Complications if they are not managed properly. And the complications cause more problems. The complications are sometimes quite serious. And so they should be managed correctly. And there are established recommendations, treatment guidelines, and patient management protocols. Now, I'm just saying this, I'm not going into the details of this, because I see a lot of these diseases, even here, even in Bombay, not managed properly at all. And in fact, the biggest problem, which is sort of exploding all over the country, is diabetes. And I see a lot of diabetes even here in Bombay and elsewhere in the country. And most of the time diabetes is not managed properly, not because the patients are not getting the correct treatment. It is because the doctors don't have the time or the inclination to advise them correctly on their diet, on their exercise, on the need to come and get checked up regularly, the need to look out for complications and so on. So the treatment of these diseases need to follow a particular system of, that is treatment guidelines, patient management protocols and all. But I will not go into all that because that's a whole area by itself, and that is very technical. Okay. But these diseases need to be managed properly because they start before old age. They start in middle age, and in some cases they start in youth also. I mean, diabetes and heart disease, I see now even in people in their 30s and even 20s because of the way they live, the lifestyle they lead. And they go into middle age and then they continue into old age, and their complications are responsible for many of the serious problems in old age. For instance, now diabetes is linked increasingly with dementia, loss of memory. 60% of the diabetics in one study has been shown to have some form of dementia or the other. So it is very, very important that these diseases be managed correctly. So that patients with these diseases need to be followed up regularly. If you have any of these diseases, it's not that you go to a doctor once, you take the medicine and then that's it. You don't have to go back to it. Or you take the medicines only and you don't bother about other things like diet and exercise and so on. So anybody who has any of these chronic diseases, these lifestyle diseases, they need to be followed up extremely regularly. And when you go to a doctor again, he looks to see whether you're responding to the treatment or not, and he may adjust your drugs or change the combination of drugs. The combination of drugs is known as a regimen. He may change the regimen if required. He may look out for the side effects of drugs and complications of the disease process. This is especially important in the case of diabetes. Now, diabetes can affect the eye, can affect the heart, it can affect the kidneys, and it can affect the nerves of particularly the nerves of the leg and sometimes with the hand also. So these complications need to be checked for, and a health education. A doctor who is treating these diseases must find time to educate patients on lifestyle modifications, including diet, exercise, weight reduction, and so on. So a doctor who's treating this must find time, or he must ask somebody to give advice on this. Because I've seen too many patients who are just given drugs and that's it, they're sent away. And doctor says, okay, you do exercise, or you be careful about your diet, but no details are provided, and the disease is not brought under control. And this is I've seen this particularly in the case of diabetes. So all those other things are important, and health education to the patient is also important. Okay, now coming to one important problem of old age, that is falls. This is one of the most dreaded and most serious problems that one has in old age, and most of us know somebody in our family who's had a fall at some time. And it may surprise you to say, if I tell you that falls are almost 100% preventable. 100% preventable. And they are not the part of aging. They happen, yes, during old age, but it's not inevitable. It's not exactly that, okay, somebody is old, they will be more prone to falls. It need not be so at all. And falls lead to very serious consequences, injuries, fractures to bones, and a loss of confidence in even going out of the house, or even getting up and going for a walk. A complete loss of confidence. And most falls can be prevented by very simple measures. Now, the causes of falls most often is muscular weakness. And what muscular weakness? The core muscles of the body, muscles of the lower back, the muscles of the the front of the thigh and the muscles at the back, the posterior, the bottom. The weakness of these muscles lead to instability and can predispose you to fall. There is also a loss of sense of balance. Now the sense of balance tends to decrease unless you do something about it. And many people, older people, you will see they are unsteady. They are not able to walk without assistance, and that is because they have lost their sense of balance. But the sense of balance, even if it's lost, can be regained at any age by simple exercises which don't take very long and are not very difficult to do either. Poor eyesight, this is an obvious cause for falls. Medications that cause dizziness or drowsiness, and some of these are sedatives, antidepressants, and antihypertensive, drugs used for blood pressure. These may cause an effect on the brain, and especially multiple drugs taken together can all add up and cause a sedation in the brain, and then this might also predispose you to fall. Certain medical conditions like stroke and arthritis. Stroke, obviously, because one part of your body is weakened, and the muscles there cannot support you correctly, and so you can be more prone to falls. Arthritis also, because the joints are stiff or painful, and so you can't use those joints as well as they should be used. And then certain environmental factors. This is quite obvious. If there is the floor is slippery, or the carpet or rug, or there's an obstruction, or there is inadequate lighting at night, and these are things that most of these problems can be addressed, and most of these things can be prevented. Now, how do we prevent falls? Normal, regular exercises like walking, jogging, cycling. Most of us walking in the geriatric age group. These can prevent falls to some extent because you tend to use your muscles, including your core muscles, and you also tend to preserve your sense of balance to some extent by these regular activities. And exercises, special exercises to strengthen the core muscles of the body. The muscles which I mentioned, the muscles of the lower back and the thigh and the bottom, there are exercises to strengthen these muscles. And some of them I mentioned: squats, planks, and push-ups. These are very good exercises. But I would not recommend that you start doing these exercises right away. It's better to take somebody's advice. A physiotherapist is the best person to advise you how to start doing these exercises. They are a little complicated, a little difficult to do. So in the beginning, so somebody who knows about these exercises should advise you how to start doing them. Exercises for balance. These are very simple, very easy to do, and just take a few minutes every day. But they have to be done every day. And of course, if your eyesight is not good, your eyesight must be checked, and any glasses or any other visual aids that you need have to be prescribed, including if you need a cataract surgery, that also should be done. And as far as medication is concerned, avoiding taking too many drugs together. Even normal drugs that don't sedate you or don't produce any depression, any sedation or drowsiness, they can, if many drugs are taken together, they can produce this effect on you. So if you're taking many drugs, more than 4 drugs at a time, then these drugs need to be reviewed at regular intervals to see if there are any side effects. I'll be coming to that, the problem of taking multiple drugs, which is also a part of old age, problem of old age, because multiple health problems and so multiple drugs are prescribed, and I'll be covering that in a little while. Environment, what you can do, as I said, mention the problems of the conditions at home, which you can change, are improving the lighting and having non-slip flooring, and grab bars in the bathroom. A lot of falls take place in the bathroom, and easy access to the bathroom at night. Older people tend to get up and go to the bathroom quite frequently, a couple of times a night. So access to the bathroom must be easy. Okay, another frequent problem which doctors encounter in older people is constipation. Constipation. Constipation is medically defined as 3 or less bowel movements per week. And the causes, in most cases, low fluid intake. Less than 2 liters of water a day for an adult. Lack of physical exercise and a lack of fiber in the diet. These are the most obvious and the most common reasons. There are medical causes also. Some drugs like antihypertensives, antidepressants, and antacids and iron preparations also tend to produce constipation. And certain major diseases, diabetes, thyroid problems, depression, stroke, and cancer of the colon. These can give rise to constipation. Now, constipation is a frequent problem and it can lead to other problems like depression and all also. So, if you are constipated, you can do something about it most of the time. How do we prevent constipation? Ensure a high fluid intake, at least 2 to 4 liters per day. In the summer, we can go up to 4 liters or even a little more. Winter, yes, 2 to 3 liters. And increase physical activity and exercise. Increase the intake of foods which are rich in fiber. Fruits, vegetables, and millets. Of course, grains like ragi, jawar, sorghum, and so on. They have a lot of fiber in them. And as far as drugs are concerned, they should be taken as a last resort, not immediately. Because all the drugs have some side effects, and some of them are habit forming, not addictive but habit forming, and then you tend to get dependent on them, and that's not a good thing. So drugs are to be only taken on medical advice. Certain situations, constipation has to be investigated. Okay, especially somebody who never had constipation suddenly develops constipation. This must be checked out thoroughly. And if there is also pain on passing stool, if there is blood in the stool, passing stool, and if there is vomiting, and if there is weight loss also. These situations, constipation is not a harmless symptom. It has to be investigated further. Okay, another problem of the older age group is taking too many medicines. Taking multiple medicines, too many medicines. And this is called as polypharmacy. And it's officially defined as taking 4 or more drugs by a patient every day. And there are concerns and problems in taking too many drugs. Unfortunately, some doctors believe in giving a long prescription with many drugs, and sometimes those drugs are, more than one of the same type, like 2 or 3 different vitamin preparations, things like that. So sometimes, or 2 or 3 different drugs for pain or inflammation, where only 1 or 2 usually would be effective. So the concerns with taking too many drugs are, all drugs have got side effects. So the more drugs you take, the more chances of you getting these, developing some of these side effects. Drugs also tend to interact with each other in the human body. This interaction can be harmful. Very often, one drug increases the effect of the other drug, or decreases the effect also. Okay, or produces some other side effect in combination with another drug. So when drugs are given together, this must be checked for, that they are not causing problems by themselves and also not causing problems with the other drug. It is also one of the causes to taking too many drugs is one of the causes of causing falls, especially with the drugs that I mentioned earlier, and I just mentioned them again, especially with sedatives and antihypertensive drugs given for high blood pressure. And when there are also too many drugs are given, the problem of the patient taking those drugs correctly also sometimes difficult for an older patient to remember how to take the drugs correctly if there are too many. So that has to be explained and that has to be checked repeatedly. So what does one do in this situation? Yes, in certain situations, multiple drugs, many drugs may be necessary for in some situations. But if multiple drugs are given, there must be a periodic review of these drugs and the dosages also. The dosages may be need to be reviewed, increased or decreased, and the drugs also occasionally may need to be changed because of side effects and interactions. And it has been seen that a smaller number of drugs at a lower dosages are often effective in the elderly. So you don't need to give more drugs at high dosages. Fewer number of drugs in lower dosages are very often effective. And sometimes a patient taking multiple drugs gets a new symptom, and that usually is a side effect of one of the side effects of the drug, and it's not a new problem or a new symptom of the disease that he has. This you must be aware of. Especially some drugs are known to produce a side effect, like some drugs for hypertension, they are known to produce a cough. So somebody who has been taking this drug, this is a drug called captopril, been taking this drug for some time and suddenly starts coughing. That doesn't mean he's got a respiratory problem, it's a side effect of the drug. Oral health of the mouth, the teeth and the gums. And it has a direct connection with general health, and it can be improved at any age. Okay, you should not feel, okay, I don't have any teeth, so there's nothing more for me to do. It's not like that. Oral health should be maintained, because oral health has a direct, if your oral health is not good, your general health will also not be good. And if you keep good oral health, you can keep all your teeth for the whole of your life. Okay, I was even surprised to hear this, but I've seen examples of it. And this is what we were taught, and we were shown examples of people who have kept all their teeth right into their 80s. And what are the measures that one can take? Brush your teeth twice a day after meals. Okay, and the practice of brushing your teeth first thing in the morning is not really helpful. It's better to brush your teeth in the morning after breakfast. It is important also to brush your teeth before sleeping at night. And one should rinse mouth thoroughly after eating, particularly after eating sweets. Okay, this is a simple measure that we can do. And the correct brushing technique is also very important. The way we brush our teeth is also very, very important. The other measures is using dental floss. Now, dental floss can get the particles of food between the teeth out very effectively, and also remove particles of plaque that develop. And this area between the teeth is difficult for brushes to reach. Yes, so flossing is extremely effective and very, very important. And it should be done once a day, preferably at night before sleeping. And the toothbrush that is recommended by most dentists is the soft or the medium type, not the hard one. The hard one is in fact harmful for tooth enamel and tends to wear out enamel very fast. One should also avoid too many sweets and sugary foods as far as possible, and avoid all forms of oral tobacco. These are also harmful to the teeth. And have a dental checkup once in 6 months to detect any problems at an early stage. Then we come to another aspect of life, not only for old people, even for middle-aged people, sleep. Adequate sleep is absolutely essential for good health. And the lack of sleep recently has been linked to a lot of problems, including cancer, heart disease, diabetes. It has been linked to poor sleep. And adequate sleep is usually 7 to 8 hours. And a regular sleep schedule should be maintained. That is, that we go to sleep at the same time and get up also at the same time. practice of getting up late on some days of the week, on Sundays and all, is not a healthy thing. And if you want to catch up on sleep, better to go sleep earlier, not sleep later. So the bedtime should be the same every day. If you are short of sleep, you can go to sleep early, but you should get up at the same time. And regular physical exercise during the day helps to improve your sleep quality. You tend to sleep better if you are physically active during the day. This is the most important. Avoid screen time using a computer or laptop or your smartphones for at least half an hour before you sleep. But that has an effect on the part of your brain which is responsible for sleep and tends to keep it active, and so your sleep is not good. You can't sleep perfectly, you get to sleep quickly. So you should avoid using these devices for at least half an hour before you sleep. Sleep, you should use the bedroom only, not other rooms. And the bedroom should be quiet, comfortable, and dark. The mattress which you use should be firm. And as far as possible, daytime naps longer than 20 to 30 minutes should be avoided. And coffee in the evening and alcohol at bedtime are also not good for sleep. Should be avoided for sleep. Now coming to one of the most important aspects of physical activity. Now, physical activity is the most important measure that you should remember to keep in good health in this stage of your life. And physical activity includes physical exercise. Okay, physical exercise is one part of physical activity, and there are physical exercises one consider. There are 4 different types of physical exercises. Aerobic exercises, which are building up stamina. These are of different types. Walking is the most common, but there are others like jogging, cycling, swimming, and also depending on what you are interested in and the facilities that you have. Of all the types of aerobic exercise, the best exercise is swimming, because that exercises the whole body. Exercises the whole body, and it does not put any stress or strain on the joints. Then we have exercises for strength. This is very important because in the older age group, you tend to use your muscular strength very quickly if you don't use your muscles. There is something called a condition called sarcopenia, weakening of the muscles, which is a natural process. But this can be countered by exercises for strength. And this can involve the use of weights, or you can do it without weights also. Exercises like push-ups, squats, and planks also develop muscular strength, which does not involve the use of weights. But one can also use weights. And exercises for flexibility at the joints. Joint flexibility is important to maintain balance and to prevent falls. And this is also important for smooth and easy movement. So the exercises for flexibility of joint, and yoga is especially good for this. A lot of yoga exercises involve stretching, pulling, and so on. And so they are especially good for flexibility of joints. And as I mentioned before, the exercises for balance. These have to be done every day, if possible. And as I said, they don't take very long. Yeah, a few details of this. Aerobic exercises, the WHO has prescribed that aerobic exercise should be done on 5 days at a minimum per week, and each time a minimum of 30 minutes. That is a total of 150 minutes a week. This is the absolute minimum of exercising. Aerobic exercise is the one that I mentioned: walking, running, cycling, jogging, and it should be done at a moderate intensity that would make you slightly breathless. So you can have a conversation, but you're not completely breathless and you can't talk. This is aerobics. So if you can do more, even better. The gains are even more. Okay, more than 150 minutes. This is 150 minutes is the minimum. Then strengthening exercises. Exercises that you do should strengthen all the major muscle groups of the body. And you can use your own body weight, as I mentioned. The exercises like the push-ups, squats, and planks, and all. You're using your own body weight. or you can use external weights. And it should be done at least 2 days per week. And the benefits are that it helps to improve the balance and strengthen the bones. As I mentioned, in the older age group, there is a weakening of the muscles and there is also weakening of bones. But these can be countered, can be prevented, or sometimes even reversed by regular exercise. Stretching exercises need to be done at least twice a week, and they should be done to the point of slight discomfort. You feel a little pulling or a little, sometimes maybe a little very slight pain. Yeah. But it should be done at a slow pace to avoid injury. If it is done suddenly or if it is done too fast, it can produce injury, and then you will be out of action for some time. So stretching exercise should be done very, very carefully. They may improve both gait and balance. The balance training exercises should be done daily, and this is something that everyone should do. Even in middle age, you should do, because otherwise some people tend to lose their sense of balance very quickly, and then that leads to falls and all the other things that happen after that. And balance training exercise also improves your posture and gait, the way you walk and the way you stand, the posture. These training exercises have an effect on that also. Some examples of balance training exercises, you see how simple they are. You can take the help of a chair in the beginning, but after that you can, once your sense of balance improves, you can do that without a chair, most of the exercises. Then we come to nutrition. Then what should one eat and what should one be careful about? Nutrition is a very important aspect of many older people tend to eat, don't pay attention to what they eat, tend to eat less, tend to eat not enough of certain things like proteins and so on. And then there are problems after that. And also, many older people are malnourished, and that is because their appetite is decreased, and or certain other reasons. Sometimes taking drugs also affects appetite. And some of the chronic diseases are linked to nutrition, especially obviously diabetes, but hypertension and heart disease are also linked to nutrition. What are the requirements? The main parts of the diet. Proteins, very important to have enough proteins in the diet, because proteins are required to maintain muscles and maintain strength. So roughly about 1 gram per kilogram body weight per day. Maybe some situations slightly less, some situations slightly more. But on the whole, on the average, about 1 gram of proteins per kilogram per day. So somebody weighing 60 kilograms will need 60 grams of proteins in a day. Carbohydrates and fats are also important. Fats, I just come to a little later, what kind of fats would one consume. Micronutrients, that is vitamins and minerals, are also important, and the important ones are calcium. In women especially, they tend to lose calcium, and therefore their bones will become weak after their menopause, after the age of 45. And so adequate calcium intake is important, especially in women. Iron, yes, iron can give rise to anemia, a lack of iron, so there should be enough iron in the diet. And the important vitamins of all the vitamins are vitamin A, vitamin B12, vitamin C, and folic acid. The other vitamins are less important, or they are not likely to be deficient. Very important thing about nutrition is the intake of water. Now, naturally, in old age, a natural phenomenon is you tend to lose your sense of thirst. And so you don't drink as much water as you should. And the recommended intake of water is in winter, before summer, is 2 to 3 liters, and in summer, 3 to 4 liters per day for an adult. Okay. This is very important because lack of water, in extreme cases, is called dehydration, can lead to a lot of other problems. Okay, especially disturbance of electrolytes, excessive fatigue or tiredness, and sometimes even fainting. So, and falls in certain situations. So, a lack of water is something that one should prevent and one should be conscious about and keep drinking water throughout the day, water and other fluids. A few words about some of the important aspects of nutrition. About the carbohydrates, whole grains and millets are more healthy. And whole grains, I mean rice that is not polished, highly polished, which has got a little bit of brown color on it or brown, some of the coating on the grains. And atta is certainly more healthy than maida. And millets are coming into very prominence now. People find them more nutritious. They are especially useful for diabetics because the starch in them is digested slowly, and so they do not raise the blood sugars suddenly like rice and wheat. So millets are extremely healthy food. They also have a large amount of fiber. Proteins, as far as proteins are concerned, the white meats, that is chicken and fish, are supposed to be more healthy than the red meats. They contain less cholesterol and other substances, fats and all, than red meats. And fiber is important, fiber or roughage. It is provided by adequate intake of fruits and vegetables and also millets. Another very controversial aspect of nutrition is fats and oils, and this is not well understood also, not well explained. So which are the oils and which are the fats that one should consume and how much. Now, in people who are not very active, the maximum consumption of fats in a month should be about 500 grams, about 20 grams per day. If you're physically active, maybe a little more. But around this much is healthy, more than that is not. And fats are of different types, saturated and unsaturated. This is something to do with the chemistry. I won't go into those details, but the saturated fats are less healthy and they have to be avoided as far as possible or minimized. They are ghee, butter, coconut oil, palm oil and palm oil. Okay, the consumption of these should be avoided or minimized. It's not that you don't never take them, once in a while you have them, it's not going to be. Unsaturated fats are of two types, monounsaturated and polyunsaturated, and the examples of the monounsaturated fats are groundnut, sesame, till oil and olive oil. The polyunsaturated fats are mustard oil, soya bean and other vegetable oils. Except coconut oil. In this group also you have the other vegetable oils refers to sunflower and so on. So it is recommended that you take a mixture. Some of the oils available in the market are a combination of these two groups of oils. Those are healthy. That's a healthy combination. Or you can take the oils in rotation. And what should be avoided completely are trans fats and hydrogenated oils. Hydrogenated oils used to be very popular in our childhood, dalda, rath, and all these. They were very popular, many people used to use them, but they are now found to be extremely unhealthy and they should be avoided or minimized. I have mentioned physical exercise, but exercising the brain also is important. Exercising the brain, using the brain. Brain is an organ that the more you use it, the better it works. Just like the rest, the muscles and the bones and joints. Yeah. So mental exercise is extremely important to maintain and preserve mental health. And the most serious neurological condition affecting the elderly is dementia. And this affects the cognitive functions, memory, thinking and communication. And this is something that can be prevented to a large extent by mental activity of different kinds. So mental exercises help to delay and to slow down the effects of dementia. There are different activities, and different activities they stimulate different parts of the brain, and they all done together improve the cognitive function. And regular mental exercises can reduce, as I said, reduce the risk of developing dementia. In the first place, it can be prevented from happening completely, and they need to be done regularly. What are these exercises? Word and number puzzles, crosswords, Sudoku, and so on, or learning a new language or a skill. Learning a new language is especially recommended if you want to keep your brain active. Learning to play a musical instrument or even listening to music. And regular physical exercise, yes. Regular physical exercise has an effect on the brain also. Social contact stimulates the brain, and the larger number of circle of friends and acquaintances and even casual people you meet, and even keeping in touch with somebody on the phone, this helps to keep your brain active. Because talking to people, again, a lot of associations are formed, a lot of older associations are reviewed or are recalled, and all these tend to stimulate the brain in different ways. Community service, any form of community service, working with people, working in groups of people, because you tend to meet and interact with people at different levels and for different things. This is also a part of mental health. Reading different types of books and also interacting with children. Children stimulate you in a different way, and then you have to come down to their level. And again, this kind of interaction has an effect on the brain. These are some of the things that are important for health of older people. And a few words in summary. As I said right at the beginning, it is possible to cope with old age. We don't fight old age, we cope with old age. And it is possible to cope with old age very well. And as I said, the main aspect, the most important aspect of coping with old age is physical activity, of which physical exercise is the most important. All other forms of physical activity, even moving around the house, doing household chores, okay, going upstairs and downstairs, going if you live on if you don't live on a ground floor, going upstairs and downstairs a couple of times. All these things are mental activity of different kinds is needed for mental health, and the correct management of lifestyle diseases, because as I said, those complications can give rise to other serious problems. They are very important, and preventing those complications from happening in the case of these lifestyle diseases is also an important aspect of care of in old age. Yes, adequate and complete nutrition is essential, is very important for people to eat correctly and eat well. Yes, and proteins must be sufficient in the diet. Protein must be sufficient because, as I said, there's a tendency in old age to lose muscle mass and to become weaker because of that. Adequate sleep, as I also said, this is extremely important, and keeping well hydrated at all times. So this is what I wanted to say. I hope this is given you some food for thought. Okay, to start thinking, and more importantly, start doing things. And I hope what I said was understood. I don't know if it was too simple, or maybe some of you may say, I know we knew all this and this is just, there's nothing new in what you said. I tried to make it easily understood. I hope I got the message across. Thank you. Any questions?
One third of humanity is in India and 2 billion from the region. There are still artisans in India. There is 50,000 bypass. There are 100 months of petrol transaction in India. Transaction of dead bodies is forbidden in India. It is also exploited opportunities of talent.
Reason for such high
cardiac disease.
reason cardiac disease
Reasons for cardiac disease.
High incidence
Where?
in India.
India.
Yeah. See, this cardiac disease has been increasing very rapidly. There are several reasons. One is the diet, excessive consumption of carbohydrates and fats. The other is a sedentary lifestyle. Okay, and in fact, recent research has found that only 10% of Indians get adequate exercise. Adult Indians get adequate exercise. And there are other reasons also, environmental and occupational reasons. But these nutrition and lack of exercise are the main causes for increased incidence of heart disease in our country.
What is the difference between Alzheimer's and dementia?
Alzheimer's is a severe form of dementia with certain characteristics, yes. And it is usually progressive and there's nothing much that can be done. But some of the other forms of dementia, they can be controlled to some extent with drugs and other measures.
Ayurveda more alternate remedy to allopathy medicine, Ayurvedic medicine.
See, I cannot comment on that because I must study Ayurveda. But our attitude that to all these different systems that they are all complementary. Now, allopathy is not the answer to all health problems, as some allopathic doctors claim. There are problems that cannot be treated in allopathy, and sometimes homeopathy and Ayurveda not work better. So there are conditions which maybe perhaps could be treated better by in Ayurveda.
Can we have a copy of this PPT presentation?
Sure.
That will help, because,
And I also want to say that any particular aspect of what I said, if you want any further details, I've given a very brief overview. Any further details, please get in touch with me through my system now. I'll be happy to answer.
About lifestyle.
Yeah.
Suppose somebody is having diabetes, BP is under control. BP is under control with normal medication. Obesity is slightly, there is a problem. And walking is a big problem today because gardens are being converted into buildings.
Yes.
If you walk on the footpath also, sometimes vehicles move on the footpath. So what sort of exercise you can do at home so that such problems are taken care of?
You have this, this treadmill at home, you have a cycling machine. You can also use those semi-reclining machines which you can half like that and then there are different ways of using machines for physical activity.
Just walking where you are up and down.
That is not so effective. You can do jogging in one place, but then that is, you have to have a mattress or a pad or something to do that. But jogging in one place is quite effective. This is a problem we have in the city, in our cities. We have and pavements are not safe for walking. There are full of obstructions. One cannot walk fast. And I said you have to walk at a certain pace. It's not possible in many of our cities on the roads to walk at that pace, which produces, it's like
Sleep is a big problem at old age. It's a very big problem. Suppose you wake up at about 2:33 in the morning, then it's very difficult to go back to sleep. I don't know in what such circumstances what one should do.
Yeah, what I said, if you go to sleep at a particular time and you don't take stimulants and all that before that, alcohol, coffee and all those in the evening, and if you observe the other things, having a dark room and a bed only which you use only for sleeping, not for other things, have a dark room completely now. This might help. And it's certain only in extreme cases like the men for constipation, you need to take a drug. When all these measures fail, then you should take sedation.
Nutrition, you said that, at a older age, the hunger really become less and less.
Yeah.
You can't eat more, because even if you have intention, you can't eat more.
Yeah. Some of that is natural, and some of the appetite decreases, and the other reason is also you tend to become less active. See, for a good appetite, you need to be active also, physically active. If you are less physically active, your appetite also decreases. So, but some decrease in appetite is a natural part of the aging process.
Can you make a copy of the PPT?
Yes, sure.
Doctor, I have a question. Normally in today's circumstances, even when you're working in an office or something, we tend to forget certain things or what happened just yesterday, what did we eat just yesterday. And then there is a thing of dementia. So how do you identify, like, whether you're really just to repeat, in today's world, even when we are working in an organization or at home, we tend to forget certain things. Especially like what happened yesterday or what we ate yesterday, or somebody comes, you know the name, but you can't, just recollect it at that point of time. And then we were talking about dementia. So how do we differentiate whether it's an early onset of dementia or is it a normal process of sometimes forgetting things?
No, all of us see younger people tend to forget things now and then. That is not dementia. When you consistently forget to, it starts with recent memory. It's something that you just done, something that you just told to you just as you might have you forget that. And you also tend to have a problem with words. Yeah. You know what you want to say, but you don't know the word to say. So these things are characteristics of early dementia. And there is a whole spectrum of dementia. Alzheimer's is the one severe part, but there are others. There's something called cognitive impairment, also cognitive impairment, which doesn't progress to Alzheimer's. These are some of the characteristics of that. Loss of recent memory.
Drug interactions. So after a certain age, it's difficult to swallow tablets. So is it safe to crush them, or if you have two tablets together, is it safe to crush them together and have it? How does that work?
No, the interaction takes place in the body.
Okay.
No, it's not a chemical reaction.
So it's okay to crush two tablets
Yes,
together?
yes.
Swallow them?
But my point, the interaction takes place in the body. It's not a chemical reaction. It's a reaction to the body, and the body is stimulated. And most common interaction is that the one drug's action is increased or decreased because of the presence of the other drug in the body. So these interactions are well known, and a doctor should check them out when he's giving multiple drugs. He should check if the drugs have.
Crushing is not an issue.
Sorry?
Crushing the
No.
tablets is not an issue.
It may create issues with the taste, but most of the drugs are bitter in taste. You crush it and then the bitterness. But if you take it with milk or some sugar or something, then that is the problem.
So my question is that ghee is benign in cell, we have said automatic. But there was a time hospitals used to recommend pure ghee, totally ghee, because it's an animal fat and compared to vegetable oil, it's sort of aligned with your body fats, and it's better medium of cooking and so what is the current status, or is there?
See, occasionally taking ghee or having cooking in ghee is not going to seriously damage your health. Yeah. But consistently using ghee definitely is not good.
What about sunflower oil?
Yes, sunflower oil, I mentioned that it's in that PUFA group. Yeah, in that PUFA group, there is sunflower oil. I mentioned other vegetable oils that includes sunflower oil. But with oils, as I said, it's important to use them in rotation. Yeah. Or if you can buy combination of oils which are available. They have two or more different oils in one packet.
Coming back to the medicine thing, you were mentioning that two different medications can have effect, right,
Yes.
inside the body. Now, if I have a BP problem and I go to my cardiologist, I also have a diabetes problem. Do I have to tell both the doctors the
Yes.
medicines that I'm taking?
Because we tend to only talk about a medicine that that doctor is prescribing and not what the other one is
No, but a
prescribing.
good doctor will ask you what other medicines are you taking. A good doctor will ask you. But my advice also to all of you is for chronic diseases, lifestyle disease, diabetes, hypertension, heart disease, and all. Don't go to a diabetes specialist for diabetes. Go to a cardiologist for heart disease, endocrine or something else. There's a new specialty for family medicine. Go to him. They are trained to see all these things together at the same time. They're specially trained for that. And this specialty has been in the Western countries for a long time. It's only started in the last 10-15 years in India. Family medicine people are trained to look at the whole body together at the same time and decide what is appropriate. Much better than a specialist like this only should go to if you have a very unusual form of a disease, that condition, or very serious or complicated, or some complications which cannot be handled at a lower level. If you can find a good family medicine person, they will keep all this in mind.
Do subsidies become part of the drugs that we take, like you said, as well as the 4 drugs we take? Do supplements form part of the 4 drugs? Like if you have a calcium supplement, a vitamin supplement, and then you have a BPA.
Calcium and vitamin are not exactly drugs.
Okay.
We don't call them as drugs.
Okay.
They are part of nutrition. They are not a part of drugs. Okay.
In the south, especially in Kerala, everybody eats, people used to, coconut oil was the medium of cooking, right? After a point it got trashed, but that was basically to make a way for Kamat to come in. Now everybody is very positive about coconut oil, and it's come back into a lot of kitchens. So I just want to know, why is coconut oil, why is it categorized along with ghee and butter as things that's on
Because of the chemical content. Because of the chemical content, the chemical structure of the coconut oil, it is a saturated fat.
Since I think we've covered most of the questions that we had, if you have anything else, of course, over the snacks, you can talk to Ravi and also correspond with him. I'd like to call Ashwini to propose a vote of thanks.
Thank you. Hello everybody, I am Ashwini Prashant. I represent the Canada Saraswat Association as well as the Saraswat Mahila Samaj Kamdevi. It actually gives me very great pleasure to propose the vote of thanks today on behalf of course, KSA and SMS. At the outset, I would like to thank our speaker, Dr. Ravi D'Souza, for his speech on coping with age, a topic which is actually the need of the hour today. I always feel that age is just a number. It is what we feel inside that counts and matters. And today, with the presentation given by Dr. D'Souza, if we indulge in those physical activities, those mental activities, and the nutrition part, I'm sure each one of us will age gracefully, and already those who have aged will further age more gracefully. So thank you so much, Dr. D'Souza. Thank you very much. Every year, our Kamat sisters, as we lovingly call them, Shubha, Vibha, and Anuja, they arrange the Professor Sadhana and Advocate Narendra Kamat Memorial Lectures. They invite different personalities, and these speakers always have some diverse and interesting topic. Today also, we had one such interesting talk. I really wish to thank these Kamat sisters for year after year sharing with us these lovely topics and also helping us get such lovely speakers. Thank you, 3 of you. Today's function would not have been a success had it not been for the behind-the-scenes support that we have all received from the following people. Guru Prasad Creators for providing us with the delicious snacks, Sri Bhavesh Jain for the stage arrangements, Shri Vivek Jadhav for the sound system, Shobana, Swati and Komal of KSA, as well as Shubhangi from our Samaj, who are always giving us the back office support that we need. The success of any function is measured by the presence of our audience. And today, we thank all of you for attending today's memorial lecture in such large numbers. It is because of your presence and your encouragement that we are encouraged to have more and more such functions for all of you. And before we close today's function, I would like to invite Anuja to speak few concluding words, post which I request you all to join us for some delicious snacks behind. Thank you and have a good day.
Thank you, Ashwini, for thanking us. On behalf of my sisters and our families, I would like to thank all of you for being here today. You've been a wonderful audience, and I think many of your questions contributed to us knowing a little more than what our speaker had included in the talk. I would also like to thank the Canara Saraswat Association and the Saraswat Mahila Samaj for their constant support year after year. They've always been with us through these memorial talks. And of course, I would like to once again thank our speaker, Dr. Ravi D'Souza. Thank you, Ravi, for coming all the way from the beautiful city of Bangalore and for agreeing to be the speaker for today's event. It was indeed a very, very helpful and useful talk, and I'm sure we will all go home knowing much, much more than we already did. Lastly, I would request all of you to help yourselves to some refreshments that have been arranged for you. Thank you once again.